Obviously, the people of the Northern Beaches have had a challenging time in the last few weeks, and those in the northern end of the Northern Beaches remain in lockdown. Clearly, we were hoping that there would be no reservations about opening up the northern end of the Northern Beaches, but of course the case of the gentleman in his 40s yesterday returning a positive case has caused public health officials a degree of anxiety, a degree of concern. But the view has been taken on the basis of the response that we saw, particularly before Christmas, from Northern Beaches residents in their willingness and capacity to come out and get tested in enormous numbers. Public health has confidence, sufficient confidence, that if we can expect a similar response from the Northern Beaches, then we can, with confidence and reservations, confidence and some reservations, enable the opening up of that community as from just after midnight on Saturday night. So at 12:01 a.m. on the 9th of January, Sunday the 9th of January, the people of the Northern Beaches will become part of the Greater Sydney circumstances and have the same rules applying to that area as applies to the rest of Sydney. As a Northern Beaches resident, I just want to really emphasise that the big issue for the public health officials was and is that the gentleman who returned a positive case yesterday had previously shown negative results. So it is concerning. Perhaps, there's no clarity around this, perhaps he has had a second infection of the virus. That's possible. But it's really the unknown that's worrying. It could be an indicator of unknown chains of transmission still circulating in the far end of the Northern Beaches. So can I say to all of our friends on the end of the northern end of the peninsula, on the Northern Beaches, yes, it'll be back to as normal as we can be in a COVID environment here in Greater Sydney as of just after midnight on Saturday. But please, please come out and get tested. We need to know, for your sake, for all of our sakes, for the people of Sydney and New South Wales and indeed Australia, that we don't have any more cases still circulating that we're not aware of. I also want to address the issue of mask wearing, as the acting Premier has indicated. Obviously, there are health orders in place that require masks to be worn at the SCG, and I want to thank the vast majority of people who are attending the SCG who wore their masks willingly, unreservedly, and did their bit to keep everybody else safe, including themselves safe. And the same order is now applicable to the A-League games in the next few weeks. Of course, as the acting Premier said, there'll be a game tonight in Newcastle. Just ask people to really make sure they do wear those masks. It is the fourth layer of defence. As Dr. Chant has told us many times, we should never forget the basic rules while we live in this world that has COVID circulating so rampantly in other parts, and that is maintain your 1.5 metre social distancing. Any symptoms of cold or flu, go and get tested immediately, and don't forget the importance of hand hygiene. Wash your hands or clean your hands like there's no tomorrow. But wear the mask. There may be some who would think that having a glass of something in your hand is acceptable as a way to avoid wearing the mask. The only person you're dudding is yourself, and of course you're also dudding the community if you don't stick with the rules of wearing a mask when you can do so. In other words, the only time you shouldn't be wearing a mask is if you're eating or drinking, and that shouldn't be all day. It should be the whole time you're there. Just do it sensibly and carefully, and do what everybody else in New South Wales has been doing, and that is making sure that as a state, as a community, we have addressed and will continue to address this COVID situation as well as anywhere in the world. Thank you.